Hi there. So, anyways, today I finally went in for my surgery. I went in at 10:15 this morning, got up at 9, but I didn't have the actual procedure done till 3 in the afternoon. They prepped me, and then they took me in, and I had local anesthesia, and I was asleep through it. And let me tell you how fun it is. Yeah, I look like fucking hell right now, but that's because I just got out of surgery and got home. If you get an implant, it's for seizures and stuff. It helps make it so you don't have to take any medicine for it. But when you go to the hospital, they put it's a trial VNS, a vagus nerve. They put it above your nerve. It's right here. That's where it was cut. And then it goes all the way to your stomach, and there's a little wire. Now, the trial run is you see how well your body handles it. And then 3 weeks later, they turn it on and program it. And how you feel afterwards, if you notice there's a little hoarseness in my voice because they make your voice kind of hoarse. And yeah, some of the side effects are you get lightheaded, you get dizzy, you get groggy. You can eat when you get out of surgery, which is really, really cool. And you can take a shower, but you have to wait a week before you can do that. You can't soak in things like saunas or a bath or any of that for over a month. But once it's healed, you can do the things you normally do. So basically, whatever you want to do. But when you get out of recovery, like after having it done, oh my God. Oh my God, you really feel like shit. So there's a scar right here, as I said. And there's a scar right there. And it's over in here, but you can't really see it. The only thing you can see is the scar. And yeah, it's not a real joyous thing. So anyways, I just got home. I'm relaxing. They gave me some freaking painkiller, thank God. I got 20 pills and I got Tylenol, which will help the pain decrease. And yeah, I'm glad it's over. I'm glad I got it done. And it doesn't really matter what type of implant you get at a hospital, for whatever it's for, whatever, disability or whatever. It does not feel good going in, because you basically got parts of your body cut open and you got stuff put in it. And yeah, it fucking hurts like a bitch. But yeah, luckily I have a painkiller, so I have that to make it go away. I have that to help me relax. And yeah, if you have epilepsy or seizures, what this does when you get it is it makes it so you don't have as many of them, and you don't have them as frequently, and you don't have them as often. So it helps with those, but it doesn't work for all people. And one thing you have to watch out for is shortness of breath, it getting infected, because if it gets infected, it can cause problems. So you have to watch that, and if you ever do, make sure you do all your research on it. I could go into all the side effects, but that would make a really, really long video. And hopefully I get better soon, and I can't wait. And I'm really, really excited. And yeah, I sound tired because, well, Today I just came home. Downtown Portland is all icy with snow and ice and slush. So it's hard to drive in. And yeah. It's hard. But besides that, let me think. I'll be laying down a lot. And anyways, hopefully I recover very, very quickly. When I came home, I was groggy on my feet. I could have stayed the whole night, but I chose not to. And so I came home tonight, which, yeah, I'm not real big on hospitals, so it's like, yeah, I'm going to go home now. So I'm home. I'm back from surgery. And, yeah, I'm going to do the rest of my recovery here. You have a little box that they send you with you home. And if you feel like you're going to have a seizure, you push the button and it'll stop you from having one. It's supposed to. And it gives you have a little thing of instructions, and it helps you with that. And you have a little discharge paper of care instructions when you get home. When you're there, they have you wear an ugly hospital gown and a hospital head thing for your hair. You're in prep. They ask you questions like, can you see your fingers straight? Can you follow their finger like this? But you watch, and they do that. They have you grab their hands like this, push forward as hard as you can, and then push backward. They have you lift your feet. I don't know. Because they want to see how good your flexibility is. They have a light thing where they look at your eyes. They check your heart. They have you on an IV. And they also use one of those things to, check your reflexes that way. They ask you a bunch of questions. It's a long, drawn-out process. But for anyone who has seizures or needs an implant, that's typically what they do. And yeah, some people have absence seizures. Some people have grand mal. Some people have clonic-tonic seizures, partial seizures. Those are the most common. There's some rare forms of it, rare forms of epilepsy, stuff like that. But I thought I'd make this video basically talking about epilepsy and what to expect. And you also can take medicines that help with it, but epilepsy is not curable and you don't get rid of it. And once you have it for the rest of your life. Some people get it in infancy. Some people get it when they're small kids. The only form of seizures you really grow out of are absent ones, and you should grow out of them when you're 11. Then you don't have this stuff anymore. But sometimes, if you're not careful, if, say, you get in a car accident or have massive head trauma, you can get it back again, but it tends to be grand mals and things like that. Because if you get brain damage, so then you're stuck with a worse kind of it. And yeah, there's also a rare kind of epilepsy, but I don't know of that kind. But yeah, I just thought I'd, make awareness for people who, I don't know, maybe know someone who has epilepsy and knows what it's all about and how you can help the person. A friend of mine has it, so I thought I'd make it. And also, if someone has a seizure, make sure you turn them on their side. Do not stick anything in their mouth because they will just bite down on it. And make sure there's pads all around them. And when you're turning them on their side, try to keep them on their side. And also try to keep their head from going back. And hold their head a little bit. Do not stick fingers in the mouth. Do not stick, sticks, popsicle sticks in their mouth. You just try to support them, be there for them, keep their head still if you can, and then call 911, and they will come and take that person to the hospital. The only reason I know this is because a friend of mine has it, and yeah, unfortunately I have it. So I've had it since I was 5, and I grew out of it for a little bit, and then because of a car crash, I had some extensive head trauma. I got the worst kind, so yeah. But I don't really make videos on this topic because, well, it's not something you want to say all over the internet. So, but anyways, I thought, in case anyone had any questions about it, because my friend did a video too, I figured I'd do one. So, yeah. It's kind of embarrassing, if you know what I mean. It's not something that, you want the whole world to know about, but I thought I'd make a video to, well, be nice and all. So, yeah. Besides that, when you get home, you're going to be happy. When the stupid scars, because they're inflamed, if you can see. So, I'm going to probably be, in recovery for about a month or so. But at least it's a month that I get to spend at home. And I'd much rather be at home recovering than a fucking hospital. So, I'm really happy. And, yeah, I'm glad this is over with. And, yeah, just remember, no matter what the implant is for, trust me, it's going to be fucking painful. Some people get them for, like, heart things, brain things, spine things. Some people get a pacemaker, and they say the same thing I'm saying. Oh, my God, I hate this. And they talk about how much pain they're in and how much they hurt. And, yeah. Anyways, that's all I have for now. I'm going to go because my voice is kind of hoarse from it. That's what happens. One of the common side effects. So, I'll see you guys later.